Moving on to drug overdoses, we talked a little bit about this before. Many drug overdoses are accidental and preventable, although others are a result of abuse of prescription drugs. Others are intentional. Your Abrams textbook talks about the general management of a patient undergoing a drug overdose. The signs and symptoms are going to vary depending on the type of medication or drug, legal or illegal, that was ingested. The top priority here is the assessment and monitoring of the patient, the potential for CPR, mechanical ventilation, IV access, IV fluids, the potential for charcoal administration for orally ingested drugs, dialysis to filter the blood to remove the medication, and antidotes for specific medications. Reversal agents are commonly used for certain medications in order to counter the effects of the medication overdosed on. We will talk more about the mechanism of action of these drugs as we examine the drug classes later on in the course. But here are just a couple of examples of the medications that we may give if a patient has overdosed or has become toxic in the levels of medication. So here we have different drug effects, different drug reactions, drug interactions. First, a synergistic effect. A synergistic effect is an interaction between two or more drugs that causes the total effect of the drugs to be greater than the sum of the individual effects of each drug. A synergistic effect can be beneficial or it can be harmful. An idiosyncratic drug reaction, it's also known as a B-type reaction. These are drugs that occur rarely and they occur unpredictably. It is not to be mistaken with idiopathic, which implies the cause is not known. We've spoke before about an allergic or an anaphylactic reaction. The term potentiation is very similar to a synergistic effect. It is essentially the same. Antagonistic, we've talked about this term before also in the past. It means that the effect of two chemicals is actually less than the sum of the effect of the two drugs taken independently of each other. They kind of cancel each other out there. A drug-drug interaction. A drug-drug interaction occurs when two or more drugs react with each other. This drug-drug interaction may cause the patient to experience unexpected side effects. For example, mixing a drug to help you sleep with a drug you take for allergies. So a sedative and an antihistamine can slow your reaction, make you more sedated and more sleepy. Drug or food and beverage interactions. These result from drugs reacting with food or beverages. So for example, mixing alcohol with some medications may increase sedation. Drug-food interactions, we spoke before about that grapefruit juice and the medication, and that also having to be involved with the CYP450 system. So that's another interaction there. You could also have drug-condition interactions. Drug-condition interactions occur when an existing medical condition makes certain drugs potentially harmful to that patient. So for example, if you have a patient that has high blood pressure, that patient could have unwanted hypertension if they take nasal decongestants. So let's think a little about how these drug interactions occur. Why do they occur? These drug interactions most definitely can affect the pharmacokinetics and the pharmacodynamics. Pharmacokinetics look at or are involved with the effect of a drug on another from the point of view that includes absorption, distribution, metabolism, and excretion, right? So we talked about that previously. Pharmacodynamics are going to be related to the pharmacological activity of those interacting drugs. So they may have a synergistic effect. They may have an antagonistic effect, or they may affect the way the cells work and transport. They may have an effect on the receptors of certain cells at certain sites within the body. So mechanism of drug interactions deal both with the pharmacokinetics of medications as well as the pharmacodynamics of the medications. So herbal and dietary supplements are also important to take into consideration. When you are doing a medication reconciliation form, when you have an intake of a patient or you are evaluating the patient's current medication regimen, you also want to ask them about herbal and dietary supplements. These supplements, even if they are over the counter, potentially deemed safe, they can interact with prescription medications and cause a decrease in a therapeutic effect or the potential for an increase in adverse effects with the patients. Take a look in your textbook in Abrams about teaching patients what should be included when teaching them about herbal and dietary supplements and over-the-counter medications. So, where do we get all of this information from? As a consumer, we receive much of our information from our healthcare providers, printed materials, perhaps from the healthcare providers. We also receive information from the television. We receive information from family and friends. We receive information from simply just Googling, right? There are websites that are made public that have great information on them. The Institute for Safe Medication Practices, the FDA, NIH, other commercial sites for drugs and drug companies. As a professional, we have textbooks, we have drug references, we have journals, we have access to programs such as Micromedics or Lexicon. We also have access to FDA, NIH, ISMP. You can also look at QSIN and the National Patient Safety Goals from the Joint Commission. As professionals, we have far more up-to-date information than the consumers are probably seeing. But what problems do you see with consumer access to medication information? There are many reputable places to get this type. We have to direct our patients to the appropriate sources so they can be informed rather than TV, friends, family, Google influencing their decisions and potentially making wrong decisions. So this is a part of the education that we should be providing our patients when we are educating them on their medication regimens and their options for treatment.